Hi, welcome to Facebook Live. This is Muhammad Shazad Khan. I'm the Executive Director of Charan Development Association. It's a national organization working in Pakistan. Today I'm moderating this session advancing health, quality and equity for vulnerable children and families around the world. And I have with me my wonderful guest, Dr. Jala Abdul Wahab. He's the Deputy Director of Polio with UNICEF. So basically, to achieve Sustainable Development Goals, when we talk about achieving sustainable development goals, it is imperative that we ensure the health for children and families, particularly those living in most insecure communities and in hard to reach areas. Currently, the world has a priority to focus on universal immunization. This is a global priority, and as part of this innovation program, we are going to talk about specifically about polio immunization. So I'll just start having a discussion with you. So why do you think, why must we remain committed to this sort of cause, particularly for vaccine prevented diseases? What's at the stake?
Well, Muhammad, today about 30% of the deaths among children less than 5 years old are actually attributed to vaccine preventable diseases. So you can imagine it's almost like about 1 million per child per year dies of vaccine preventable diseases. And this is not to say that a lot hasn't been done in improving vaccination coverage. So today you're looking at about 86% of the children around the world have 3 doses of DPT, which is very good. But if you remember also the fact that with measles, we've reduced mortality by over 70%. With neonatal tetanus also, we've reduced it by 83%. So there have been significant progress. However, the challenge is that if we turn our back on this, we can actually lose a lot. So for example, with polio eradication, since I work on polio, we've actually achieved tremendous progress. There's only 2 countries in 2017 that have reported the wild polio virus. And we've seen tremendous progress in terms of the restriction in those countries. So in Pakistan, in Afghanistan and Nigeria, those areas are very, very well defined. So the point is that if we turn our back on this situation right now, we'll see a resurgence of this virus. So for polio, today we have about 10 cases in 2017. In 2016, we had 37 cases of polio. If by the end of this decade we don't finish this job and give up on it, we can actually see within 10 years about 200,000 new paralyzed people per year. And those are new cases that come. Again, 200,000 cases.
That's a big number.
And that's a huge number. And this is not to mention all the other vaccine preventable diseases. So yes, we have overall coverage, but as you said, the main issue right now is not leaving anyone behind, which is the SDG theme, is that most of the vulnerable children who will be affected are actually the ones who will be affected by the vaccine preventable diseases. So I think the goal is to continue and finish this job.
So how do you think that this immunization fits into the broader goal of universal health coverage? How do you think?
I think it's important to remember that immunization, or the expanded program on immunization, is actually in most countries probably the most far-reach program that we have in terms of its reach into the furthest corners of the country. So in vaccinations, you can actually, it provides a platform to deliver other services, whether it's nutrition or WASH or health education. So immunization actually is the backbone of the furthest outreach of service delivery. And actually in polio, which is again relevant to it, polio is an eradication program. And by meaning, eradication means you cannot leave any single child without being vaccinated. It means we want to wipe the virus off the face of the earth. And so it's actually universal coverage with the vaccine. And there's tremendous lessons that we've gotten through polio in terms of how to identify and reach the most marginalized and disadvantaged communities. It means that we'll have to go out of the ordinary way of operating, to partner with new people, to partner with civil society, to engage local leaders and women and youth to actually reach those and identify what services they have. So I think there's a strong link between immunization as a central theme and universal health coverage, but as well as between polio and the lessons learned in reaching those forgotten children and those forgotten communities.
And as you know, that immunization is the only intervention actually that can eradicate the diseases from the planet. So you rightly mentioned about this as well, that we have to go out of the box. So what do you think, how do you see the role of innovation in advancing health, particularly for the health of children and families?
Often people think of innovations as the modern technologies, whether you deliver things through mobile phones or social media. And those are very, very important innovations. There's also the innovations of new vaccines and new formulations of the vaccines. Those are also very, very critical for the advancement of the program. But I do want to take this platform to talk about an innovation that's actually quite central to the way we work, especially with polio and the UNICEF's role in polio, which is one innovation is using the community-based vaccination strategy, which basically is a marriage between the operations arm and the communication arm. So not only are you identifying these communities, but you're also having a conversation with them. You're having a detailed collection of data to understand what are their norms, what are the things that they are challenged with, and to develop trust between the healthcare provider and between the community and the leaders. And so this kind of strategy is also based a lot on women, because women open doors.
Yeah.
They're the ones that are able to access this. And this strategy is actually being implemented today in Pakistan under the leadership of the government to actually reach those communities and provide regular services to them. So on the one hand, you develop trust, but on the other hand, you also hear what these communities want. And the bridge of that is actually what we want, to reach those communities.
So actually, you mentioned that in Pakistan particularly, there are more than now 250,000 health workers, the Sehat workers, Sehat mobilizers basically, Sehat protectors they can call. And the innovation that they are using is basically they have the mobile health units which go out and reach out to communities, particularly to find out those communities, those children, who are on the move. So to identify those, it's very important that we have this kind of innovation, and it's not only the technology, but how out of the way you can go to reach it, to ensure that no one is missing, particularly for the eradication.
So just to also say, I mean, these strategies, I mean, even though they're taking place in some of the priorities areas for Pakistan, for polio, like Pakistan, Afghanistan, Nigeria, and India, we're also taking those lessons learned to pilot them and disseminate them to other countries. So as we speak, there's a workshop that includes more than 33 countries to take this innovation and spread it. And the workshop is taking place right now in Amman, and to see how does communication help us achieve that last mile of reaching those children. So it's an important
as you're based in UNICEF, and you're working particularly for polio, what does it take, to advocate for this change, particularly when we talk about health and development challenges of this magnitude? What does it take to advocate for this change?
I think what it takes is gathering and using quality data. I think that's one thing. You have to have that in order to make a move in either the right direction, or if you don't use the data, you're going to make it in the wrong direction. So that's, I think, central thing is the use of quality data. But in order to actually advocate for change, you need two approaches, bottom up and top down. And what I mean by top down, you need the leadership to be committed and to have their buy-in so that they allocate the resources, both the financial and the human resources, to the priority areas, which are the most underserved and unreached areas. Then you need also the bottom-up approach, which is, again, the community. And we're talking about the youth, we're talking about the community leaders. Women empowerment has been central for polio, and I think has been essential for immunization for years. They are the mothers as well as the healthcare providers in many of the areas, as well as their networks using that. So I think the combination of using top-down and bottom-up, as well as being fed with quality data, gives you, the advocacy tools to achieve what you need in immunization.
Yeah, so there are millions of frontline health workers actually that are working on the grounds and trying to make an impact, reaching out to all the children and families. So particularly because as a youth leader, I'll ask you that what role do you see for young people to play, and particularly taking this agenda forward?
Yeah, so for polio relies heavily on volunteers, and most of those, more than 20 million actually across the world, polio volunteers are actually youth. And so youth are already involved, but I think there's always room for more involvement. I think social media is quite an important tool for the youth, but I think it's always important to verify whatever we're disseminating and make sure we trust the source. And that's why we go to reputable organizations and people we trust to actually share those resources. The other thing is actually engaging in direct advocacy and mobilization at community level, such as with organizations like Rotary International, which spreads across many countries. And then finally, I think conducting such interviews to provide a platform to disseminate this information and have a conversation about it from among different people. But I think if we don't invest in youth, and if youth are not part of what we do now, we can't, we can't achieve what we want in the future.
Yeah. So in order to ensure the sustainable finances and also strong government commitments, what do you see? How do we ensure that?
In order to continue the job and finish it. I think, one thing is it is our moral responsibility to provide health services to all equally. And this is part of the SDGs, and especially in goal number 3, which focuses on health a lot. And if you take it from an evidence point of view, there has been research done that for every dollar that we invest in immunization, we get a return of investment of $44. So the equation is quite clear, and even from a polio perspective, we're talking about so far to date, since the start of the initiative in 1988, we have about $27 billion in saving from the cases that we've prevented and averted. And so this is clear evidence that this is a way forward, and also for a community to fully function at its full capacity, immunization actually helps us to achieve that. And one way to move forward with this, as we said, is advocating with the right leadership and with the right community, but also using the opportunities that are available. So for example, I want to take this to highlight one specific tool. We don't have to start from scratch. We have a lot of things already set in place. And again, going back to polio hopefully will be eradicated by the end of this decade. And the idea would be that a lot of resources and tools and lessons learned, specifically targeting the most marginalized and underserved and unreached populations, have been outlined by polio, and we have live experience for that. So it would be good to have that from other programs, to take those lessons, those assets, and actually build on them. Polio has actually provided more than 1.3 billion doses of vitamin A, saving more than 1.5 million lives. And so there's a lot of synergies between those that we can build in the transition post-polio.
Yeah. So at the end, those who are watching us on Facebook Live, what action do you ask them? What is one thing that you ask them to do right after this session, or maybe in coming days? What do you suggest should be their action to contribute in eradicating the polio form?
I think internally, within our circles of friends, within our families, I think it's good to have these discussions. Often we end up doing them on social media only, but it's also good to mobilize in the communities, in our living rooms, in our gatherings. And so that's one thing, to continue having that dialogue. We learn a lot and we exchange a lot still through that. The other thing is, as we said, to engage at community level as well. I think the leadership needs to come from the youth, and is coming from the youth. And you can see fresh ideas and new approaches to things. So I think engaging with local organizations at a young age, feeling that you are part of an organization or a community, helps build that character for future leaders, and it will be important to sustain that.
Yeah, well, thank you very much, Dr. Jala. At the end of this discussion, I'll just say that most often when the frontline health workers who reach out to people and children and families, when they reach to your door, to cooperate with them, because they are there not only for the immunization, but also they open up the avenues for covering the other health issues of the world. So
I think that's one of the, probably the best thing to take this platform, is to thank the frontline workers. They are our heroes. They are the ones we've reached where we are because of the work that they've done. They've put their lives at risk, they've put their families, they've prioritized a lot of their work, to get the vaccine to those children. So from my stand, I do want to thank those health workers and frontline workers, a lot of them who are youth and women, for all their efforts that they've done.
Yeah.
And we're very proud of those heroes.
Yeah, coming from Pakistan, you know, a lot of those frontline health workers who actually reach out to the people, they have suffered and they have given their lives, you know, saving the life of the children and the families. And we do want to thank them, of course, from using this platform. Thank you very much for the Facebook Live, and hopefully that discussion help you in terms of taking an action to eradicate polio from the face of the earth. Thank you very much.